virtual interview. So today we have a very special guest with us. So Dr. Omar, welcome to this interview.
Thank you, Abhiraj. Thanks for having me, and I look forward to having this conversation with you.
Okay, so can you please give us a short introduction about yourself?
Yeah, absolutely. So my name is Omar. I am one of the third-year internal medicine residents at the Mayo Clinic in Arizona. I am an IMG myself. I am originally from Kashmir. I went to med school at Al Faisal University, College of Medicine in Riyadh, Saudi Arabia. I graduated in 2020, and that was the year I applied to the residency match. And obviously, we were the first class to go through the residency after COVID started, so things were quite different our year of match. And I have an interest in cardiology. I really enjoy mentoring med students, medical graduates, especially IMGs, in my free time. And that's something, mentorship and medical education is something I'm passionate about. In my free time, I enjoy soccer. I love watching and playing soccer. Many would call it football. And I, enjoy exploring national park with my wife as well. And, it's nice being here and talking to you guys.
That is awesome. So thank you for being here. So can you please tell us about your USMLE journey, like when you started, okay? So why did not you go for PLAB and all?
Yeah, absolutely. I think that's an important question for anyone to consider. Quite often, there are a few factors that go into that decision, US residency versus something else. The first thing is personal circumstances. Some people may have family ties somewhere, and that may help, drive that decision. Some people, depending on the credentials, depending on, financial constraints, those are some other factors that also contribute to that decision. I think for me, we had several seniors from med school who had pursued the US pathway. So we had a pretty strong, senior alumni support, although our med school was still quite new and young, but I think we had, we had this pipeline of several graduates who had pursued the pathway. So we had that available to us. Guidance was available. I felt, another reason is people want to think about what kind of healthcare system they want to be working in. Every healthcare system is going to have pros and cons, including the US one. I had done some summer research in the US, during med school before I had applied to the match, and I kind of had a general sense of what healthcare looks like in the US and what training looks like in the US and what the prospects are, post-training and all that. And I felt, connected to the training system, and I felt that it would be conducive for what I see and how I see my professional and personal goals evolve. I had some extended family members around the US, so I think that was also an added factor. And as mentioned, in terms of my journey, I applied to the residency match in 2020, and a lot of things were different that year because of COVID. Electives, clinical rotations were suspended, canceled. Step 2 CSO was suspended. They introduced the pathways system for ACFMU certification. So there were a lot of things that were different. It was, people were anxious, people were nervous because virtual interviews. It was the first year to do virtual interviews, so there were a lot of different things, a lot of new things. But we're glad. I think peer support made a difference. We all worked together through all those new obstacles, and we made it, fortunately. So taking things step by step, just kind of working through each obstacle. Before you think and worry about the next one, I think that helped. And so things were quite different during our year, and but I'm glad I'm on the other side.
Yeah, that is a little bit of inspiring journey itself. So talking about now the research, now there is this hype of doing research to apply for the US residency. So what are your thoughts on research, and what tips do you have for the applicants like us who are planning for the US residency?
Yeah, research is always a heavily discussed topic. The bottom line is research generally isn't for everyone. Not everyone's interested in research, right? And that is totally reasonable. You know, a lot of people who eventually finish training, some of them go into academic medicine, some of them go into private practice, and obviously there's a lot more emphasis on research in academic medicine. And people who just feel like they don't want to be doing research on going long term, you know, they consider a more non-academic career, which is also totally fine. So, you know, bottom line is not everyone's going to be interested in research. But for application purposes, certainly research does add value to your application. Programs are now more holistically reviewing applications. You know, scores alone don't matter. They will look at your other things, your research experience. They will look at your volunteering, leadership, and so on. And especially if you're applying to academic programs, they will want to see what research experience you have. So I'd say, you know, certainly to strengthen your application as much as possible, definitely get some research experience. And that does not necessarily mean you need to do a research position in the US. You know, people can publish in very big journals from their own countries. You don't really have to come to the US to do research for that. My advice generally would be identify an area of interest. If there's a certain specialty you want to pursue, if there's a certain area in that specialty that you are interested in. For example, if someone's interested in cardiology, any specifics, interventional, EP, imaging, and then you could even stratify it further, you know, like cardio-oncology, preventative cardiology, cardiogenomics maybe. So, you know, that will help kind of shape your research interests and what projects you get involved in. So, and you want to be enjoying what you're doing in terms of research. So, you know, there's that, find a mentor, a faculty mentor, it always helps. Not compulsory, not necessary to do research, but help shape your interests. And, you know, always try to think of how can you publish. Case reports are easy, and then you think about reviews, and then you think of systematic reviews. Obviously, randomized controlled trials is like very uncommon. Unless you're at a big academic center, you're probably not going to have a chance to, you know, participate in an RCT. But that would be like a big, high quality research experience to have on your application. And then beyond publications, think about poster presentations. Think about abstract presentations, because all those count, and you can add those in your ERAS CV as well under research. So not just publications, but also think about abstracts and posters and oral presentations.
Okay. So I have this one question, that talking about the research interest, we actually mentioned interest the word so many times. So generally the applicants think that you want to have the research to get matched, you want to have this number of researches and all. So and then they start doing research when they actually start their USMLE journey and all. So does that actually reflect on either you are actually interested in research, or you are just doing for the sake of USMLE and all?
I mean, I think no one can make that assumption about anyone that, oh yeah, so this person started doing research because they're applying to Match. I mean, even if that was the case, the person still started doing research and they published, so they would get credit for that, you know, regardless of when you started your research. In terms of number of research and all that, you know, NRMP, the Match authority, they publish data reports every year. So they look at the Match, they look at all the applicants, they look at, you know, for certain specialties, what was the mean number of publications, the mean number of abstracts, and so on. So I highly recommend anyone, you know, interested in applying to the Match to go to the NRMP website, look at those reports, those Match reports, because you'll be able to see what was the average number of publications matched applicants had in internal medicine, you know, or matched applicants had in neurosurgery. And that'll give you a sense of where you want to stand generally in terms of how much research you should safely have, you know, to have a good chance of matching. So everyone's research profile is going to vary. Some people are going to have less research than others, but the point is try to get some research experience. You know, it doesn't have to be a lot. 1, 2, 3 publications should at least demonstrate that you are interested in research. And another important thing to keep in mind is there has to be a balance between quality and quantity. People can have 20 publications, but they may be incredibly low quality, you know, in very low quality journals. That does not value for as much as having 5 publications in very well known journals. So I think that's always important to mention. Don't focus on just churning out paper publications, but the quality should also be there.
I think with that answer, most of our viewers will be relieved. So now moving onwards to the next question. So what are your thoughts on USCEs, like how IMGs can get very good USCEs and LORs? Like you yourself did your USCE in the Mayo Clinic. So what thought do you have on the USCEs?
I think for USCE, the main tip I would have is plan early. Because many of these places, they have deadlines of 3 months in advance, 6 months in advance. So you want to identify where you want to do USC. Certainly, as long as the priority should be for something that is hands-on, is at an academic center where you will get letters which would have strong value, right? A letter from a big name would always add a lot of value to your application. So those should be the priorities. And then obviously, if someone's having difficulty finding something at those places, then they can think about medical centers. If even that's not possible, like non-academic hospitals. If not even that, then private clinics. But any USCE is better than no USCE. So USCE is important. It's a very important aspect of your application. I would prioritize that over research. If someone had to choose between the two, I would say USCE is more important. You get good USCE, get good MOR, strong letter of recommendation, and that will add good value to your application. So, and obviously that takes a bit of searching. You have to look up websites. You have to know, what hospitals are offering those electives, and then apply accordingly. See what requirements they have. Start working on the requirements. Some need immunization, some may need some healthcare, screening, testing, and so on. So you want to work on all that in advance to make sure everything is ready on time. So reach out to your seniors, reach out to alumni, reach out to faculty, reach out to programs, explore what options you have in CE, and plan effectively. Prioritize which USCE you would want to do. There's always that cost, perspective. Some USCE are very expensive, and then there are others which are far less expensive and very high quality. A very obvious example is Cleveland Clinic and Mayo Clinic electives. Those are like, I think, $300, $400 per month versus $2,000, $3,000 that many private companies charge for a month of USCE. Now, the caveat is Mayo, Cleveland, some of those electives need you to have done step 1. So that's another challenge people run into, like, I haven't done step 1 yet and I can't apply to those few USCE. My recommendation is, in that case, really try to finish your step 1 so you should be able to apply to these very good and cheaper electives. Because getting step 1 done does open more doors to get USCE.
Most of the IMGs at this time are now in the US doing their USCEs. So what tips do you have for them to actually make the most out of their USCEs?
I think I've always thought that with the USCE, it's a lot more about just clinical knowledge or clinical skills. Your attitude, your character, how you go about interacting with people, how helpful you are, how much of an addition, a positive addition you are to the team, how open you are to feedback, how curious you are, to learn more. These are things that matter a lot. You're there to learn. You're not expected to be an expert, but you want to demonstrate that you're really willing to learn. You're here to learn. You're here to improve. You can take feedback. You can apply that feedback and demonstrate, tangible improvements. So I think attitude goes a long way, communication goes a long way, confidence. I think a lot of IMGs struggle with confidence, and I feel like that's like throwing an axe at your own feet. We are shy, we're hesitant. Some of us may have come from systems which might be very hierarchical, right? You can't even look at your professor in the eye and stuff like that. You realize that things in the US are much more personal, much more casual. And you can look at your faculty in the eye, you can talk to them, you can have discussions, you can, ask questions. Asking questions is not looked at or perceived as something like, insulting or something that's, offensive. So I think also better understanding those cultural differences when you come to your USCPs. All these things will matter. So not just clinical experience or clinical skills or knowledge. You really want to demonstrate that you're a good person. The program would like to have you as part of the program because you're just a good person, good to work with. I think that's really much more important than demonstrating top quality knowledge or skills. Those are important as well, and having, demonstrating an understanding of the system. But I think attitude, character, communication, confidence, those would be, key elements to demonstrate in your USC.
You gave a very realistic and doable answer to that question. So you matched at Mayo Clinic, which is the US #1 healthcare system actually. So lately also, I would like to congratulate you for that. And what tips do you have for the applicants who are planning to match in a top program like you?
So, I feel like I did nothing special, to be honest. I feel like anyone else should be able to match at a very good program, and we already have a lot of IMGs who are matching at excellent programs in very competitive specialties. You'll realize as part of this process, there'll be many factors that are beyond your control. You cannot control those factors. You do what you can in terms of strengthening your application, but there'll be many things that you just cannot control, and you shouldn't really necessarily worry about those factors, right? So, looking back, I think my first thing was I never prioritized scores alone. I knew that scores alone would not be the full story. I will need to have a more holistic application. So I certainly, got involved in several volunteering, leadership opportunities as a med student, some research experience under the belt, and so on. So just kind of making sure that I have that overall holistic application in addition to reasonable scores. I didn't have stellar scores, but I had decent scores. And again, I was talking about USCE. I think really it was the USCE or the elective I did at Mayo that made the biggest impact. I was able to come here. That was the only elective I had that match. I had only 1 month of USCE. That's it. No other USCE, that match season. So that 1 month, I was able to get a few letters of recommendation. I was able to get to, know the program, the faculty, the residents, and I think that made all the difference. And that would be true. That's another factor you want to factor in when you're looking for USCE. Hey, should I also do a USCE at a program where I had the chance to match as an IMG? At that time, honestly, I was limited on options, but Mayo was the best and only USCE option I had. And overall, it was a great learning experience. And, I think that really had the biggest impact on my application. So getting to know people at a program, making connections, networking, all these things you realize are a very important aspect of this match process.
That's awesome. So how is life in residency? What is your experience so far?
Residency is an important stage in medical training, and truly every program is set up differently. There are some programs which are more front-loaded, which means they have very busy rotations early on and then they're lighter. Some programs are just kind of evenly spread out. And depending on where you are doing residency, that will influence your experience. For example, if you're in a community program, there's probably going to be less emphasis on academics research, but certainly a lot more clinical heavy, right? You're going to get a lot of clinical exposure. If you're at an academic center, there will be some expectations from you as a trainee to also participate in academics and research. And I think, I have to say at Mayo, it's a very balanced experience. Mayo has 3 shields in its logo, and 3 shields stand for patient care, research, and education. And, that kind of reflects in their approach to everything they do, and that also stands true for our residencies. We get a very balanced experience, a very excellent clinical exposure, diverse pathology, We are a referral center in the region. We have patients who are brought in from all the neighboring states as well. Very good support in terms of academics, research, and then scheduling wise as well. Every program has a different scheduling system, and we have a very nice scheduling system as well, which allows for a good balance, in terms of our work-life balance. You'll have inpatient and outpatient rotations as part of residency, and inpatient rotations are usually busier than outpatient rotations. So just the way our schedule is set up, it really allows for a nice alternation between inpatient, outpatient, and really you never go on too long on an inpatient stretch, which would be very busy. So I have to say, the experience has been great, very well balanced. And, on top of that, again, talking about what kind of program you'll be doing training at, Mayo has a big transplant program. Mayo has a, very prominent oncology, heme-onc program. So certainly, we get a lot of exposure to transplant patients, to, cancer patients, which some other centers or programs may not have. So every program has something different to offer. Depending on where you are training, that will influence the overall residency experience. But I have to say, it's been a lot of great learning and growth, over these past 3 years.
Yeah. So you have been exposed to a different medical healthcare system in your country too, and you're also exposed to the Mayo Clinic system. So if I ask you, what is the one thing that you love the most about the Mayo Clinic, then what would that be?
So specifically my Mayo Clinic, I have to say it's the culture of respect, the environment of respect. I think, everyone attests to that. Even if we have visiting students, visiting residents come to Mayo, that's one of the things that really stands out to them. They're like, hey, everyone's actually pretty nice. If you're talking to an attending, if you're consulting a service, everyone just has respect for each other, for, what every other person does or every other team does. So I think that sense of respect, the sense of collegiality really stands out at Mayo.
That is so inspiring. So you are now about to complete your residency. So this far, do you have any regrets or anything you think that you would have done better?
I think that is a very dangerous state of mind to be in. I don't have any regrets. I think within the realm of my circumstances, there's really not much I could have done better. But when you think about doing better, that chain of thought is never ending. Someone who has 5 publications will think, I wish I had 10 publications. Someone who has 10 thinks they wish they had 20. Someone who has 240s in their step 2 wish they had 250s, and someone who has 250s wish they had 260s or 270s. So, I feel like I would advise against looking back and regretting and thinking how you could have done something differently, instead of really just being grateful, being appreciative of how things worked out, and however they worked out was likely the best way for them to work out, right? So certainly, if you look back, you can pinpoint 100 things that could be better, right? Oh, better scores, better research, better monitoring, better networks, better networking, better connections, right? Bigger number of interviews, maybe. So in many ways, things could be better, but would that matter? I don't think so, right? So I feel like everyone should focus on doing their best within their circumstances, and based on that, as long as you know that you did your best, in your circumstances, you should feel proud and you should be happy with how things turn out or however they turn out. And I think often comparing yourself to others will do you more harm than good. Comparisons will never, it's never a fair comparison. If you start comparing your credentials to a colleague's credentials, you guys have very different circumstances. So I don't think it's fair and reasonable to compare and draw conclusions from that. Oh, okay, my credentials were like that. This person's credentials were like that. We got so many interviews, and this is where I matched, and this is where the person matched. There are just so many factors that go into this whole process. I don't think that makes sense to compare it that way. So yeah, I mean, theoretically, many things could be better, looking back, but I think things worked out very nicely, and I'm grateful for that.
So, talking about the satisfactions and comparisons that we subconsciously tend to do, so what do you think makes an ideal candidate for the match?
I think if you ask me, I will probably, kind of re-emphasize the similar things I mentioned previously. I think having a holistic application, demonstrating that you're good, you're a leader, you can lead if needed, you have good interpersonal skills and good attitude, you are able to take feedback positively and openly and apply that feedback instead of, taking it personally or getting offended. I think these are the traits that programs like seeing it there. Trainees, at the end of the day, like, they would rather have someone who is less stellar but is very open to feedback, is very good to work with, is very helpful, is very supportive of their colleagues, versus someone who is a gunner, has incredible scores, 50 publications, whatever, but then takes feedback personally, isn't really supportive of the team, and so on. So like, at the end of the day, it's all a balance. I honestly, if I was a PD, I would not stop at just scores and publications and all these things. I think I really need to know what a person is like as a person, and I think the idea of your experiences is to try and demonstrate that. And if someone has a lot of community service, for example, it maybe demonstrates, hey, this person really likes giving back to the community. Maybe that means this person's actually, pretty nice to work with, is really willing to be out there and help people. And that's why you use your experiences to shape that perception of a program about you. So again, holistic candidate, good person, good to work with, good interpersonal skills, confidence, and leadership. I think those are the things I would be looking for in a candidate.
Okay, thank you for that answer. So, in regard the reference to your answer, so what tips do you have for someone who is applying this year for their personal statement? You talked about experiences and being a better person overall. So, what tips do you have for someone who is writing their personal statement?
So we can talk about personal statement for hours, but if I were to keep it summarized in brief, I think the first thing is IMGs. Many of us do not know how to write a personal statement, honestly. Same with me. My first draft was tragic because many of us don't write personal statements before we apply to residency, right? The American graduates, they do it when they're going to college, into university, med school, and so on. For a lot of us, it's the first time writing a personal statement. So get help, get advice if you need to. Once you finish up your personal statement draft, get it reviewed by your peers, by your seniors, faculty, colleagues, friends, family, whatever, but just get it reviewed from multiple people. Now, talking about the personal statement, it should not be a regurgitation of your CV. That is not the point of a personal statement. It really needs to be personal. It needs to be about you. It needs to tell me more about you as a person and your journey, basically. So one main advice I got was identify a foundation, identify a theme to your personal statement. Is there that one thing, maybe an experience, maybe a life story, maybe a hobby, something that you can use to tie everything together about who you are? Some people, I spoke to some residents before, they wrote about soccer, how they were the soccer captain of their team, and how that helped them develop teamwork skills, leadership, and so on, and how that's very relevant even to medicine and stuff like that. So find a focus and tie your whole personal statement toward or around that focus. Length should be less than 1 page. Make a mention of why medicine, why you pursued medicine. Make a mention of where do you see your future? How do you see your future evolve? What do you want to do in the future? Give them a sense. You talk about what are you looking for in the program? Talk about what are your qualities, what do you bring to the program, right? So I think those are a few aspects of a personal statement, but obviously it's something we can discuss for a long time. Point is, get it reviewed, look at examples of good personal statements, keep the length, under one page, make sure it flows, no errors, grammatical mistakes, and tie it all together under one theme.
So that was a very informative session so far. So we move on to the last part of our session. So what is your message for the exam preparation, or someone who is actually now in the midst of their USMLE journey, and for those who are now applying for the match this year?
I think one of the pieces of advice I would have, obviously looking back, things were quite overwhelming, things were stressful, and they are stressful for anyone going through this process. Everyone's, facing certain challenges on the journey, whether personal, whether financial, whether time challenges. Take things step by step. Do not worry about the whole thing. Don't look at it as like a huge wall in front of you, right? Look at that one brick in front of you, which is step one, USMLE step one, and then focus on that, get that done with. That's not to say that you shouldn't prepare for other things. As I said, for USCE, for example, you may have to prepare in advance, but don't let that big picture overwhelm you. Look at it piece by piece and take things step by step. Seek support, seek help. Your colleagues will be helpful on this journey. Instead of toxic competition with your colleagues, develop very positive, reinforcing connections with your peers, with your medical school classmates, and the people on the journey with you, because that can make a big difference in your journey in terms of the advice you will get, in terms of them helping guide you through this process. That can be very helpful. And take care of yourself during this process. Many people may end up in a dark place where they feel very hopeless, they feel depressed, they feel like they will never match, or things will not work out the way they hope they will. But trust me, all of us feel that way in that position. As I said, have a focus on the end goal, take things step by step, believe in yourself, believe in all the work you've put in, all the hard work you've done, and how you've been strengthening your application. You've come a long way to be able to apply to the match. So believe in everything you bring to the program, believe in your skills, demonstrate confidence on a day-to-day basis. It is a big deal that you are, in a position to be applying to residency. There's a lot of work that goes into all that, and you should definitely be proud of yourself to do that. And take care of yourself. Have a support system around you, family, friends. Take things step by step. Don't stress about things that are not in your control. Do not think about where you're going to match and how you're going to get there before you've even taken step one, right? So step by step, don't worry about things you don't control, and just focus on things as they go.
So thank you for being with us today. You actually inspired and helped me, as well as most of all of our viewers. So I hope best of luck. I wish you best of luck for your future. So thank you for being with us, Dr.
Thank you, Abhiraj. It was a nice conversation with you. I am always open and available to for people to reach out. You could share my YouTube channel with them, social media, Twitter, Instagram, whatever it is. I'm happy. I'm available. If anyone wants, a personal statement reviewed or advice on the application, I am more than happy to do that. And I hope that, down the line, people are able to give back to the others applying, to the match, because that's the cycle that needs to continue of us helping each other and really guiding each other through this process. So thank you, Abhiraj. It was nice talking to you.
Thank you, Doctor.